Hello everyone again. Welcome to Lab 5 where we are going to talk about the joint flexibility measurement. And the idea for today's lab is to do some joint flexibility tests, get some values and compare it with the normative data available. So here is the presentation outline for today. As we have always been discussing in the 4 labs before, that whatever test we are going to perform, which is joint flexibility, we always want to know why it is important. Then we will talk about the definition and some of the factors which are responsible for joint flexibility. And then we will brush up some of our anatomical knowledge from before and talk about some of the mechanical properties of joint flexibility. Very briefly, I will talk about a couple of instruments which we use to assess joint flexibility. But the main focus is on the last 3 points. How to test, or what are the tests which we use to check the back and hamstring flexibility, and what are the tests which we can use to check the shoulder and the chest flexibility. So we are going to discuss 2 tests each, which means a total of 4 tests, and you are going to do 2 tests for the back and hamstring flexibility to solve datasheet 3.1 and then compare these values with the normative data tables as we did in our first lab during lab 1, and I will walk you through how to enter the values in that data sheet. So we are all set, and let's start as we always do, that what is the purpose and reason for learning about this topic, which is joint flexibility today. So this is just a picture, and I want you to maybe take a 30-second pause, stop the video and try to think that why joint flexibility is important. Great, I hope that you have paused the video and come up with some answers, and if you have the same answers which I'm going to talk, then you are doing a really good job. So the first thing is that if your joints are flexible, you are less likely to get injuries both while doing your day-to-day activities as well as if you are playing any kind of sports or doing any kind of exercise. And if your joints are flexible, they are less likely to get sore, and you will get less pain and less prone to injuries, as I've been pointed previously. It also has an advantage of getting a proper posture and balance. It will stabilize your core muscles and you will feel greater strength as we do more and more flexibility exercises. It helps you to build up more and more endurance for your muscles, and overall you will feel an improvement in your quality of life. So I'm sure that you have come up with some of the pretty good answers apart from these points, and I really appreciate if we can discuss it in our lab today. Now, the first important thing that we have been talking about joint flexibility all the time since I've started, teaching this lecture, but I want you to be exactly aware what flexibility scientifically means. So this is a really good definition. It says that flexibility is the ability to move a joint. It can be one joint or it can be a series of joints. For example, if we are moving our thumb here, there's movement of only one joint. But if I'm rotating my wrist something like this, then there are a few joints, more than one joint which is moving, which means that the movement can either be of one joint or more than one joint. And the second part of the definition says, which I've highlighted in red, is that this motion has to be full, it shouldn't be restricted, and once you are moving, the whole ROM or range of motion is pain free. Ideally, you should not feel any kind of pain while moving your joints. So these are some of the factors which affect joint flexibility, your bony structure. At some of the bony structures, the movement is more, for example, a shoulder joint. At some of the structures, for example, your foot, the movements are a bit restricted. And that depends upon the anatomical joints as well as the ligaments which are attached to these joints. Age and gender both have an important role. As we age, our flexibility decreases, and females are way more flexible than males. Now, why people have different flexibility and how does this flexibility varies amongst individuals? It depends upon the elasticity and plasticity of our connective tissue which constitute the joint. And I will talk about these two terms specifically, elasticity and plasticity, in just a bit. It also depends upon the muscles and their tendons. Skin is also important. If you have a hydrated skin, it's more likely to have increased flexibility. Body fat, another important factor. A lot of adipose tissue will hamper the movement at different kind of joints because it limits stretching to some extent. As far as the occupational and recreational activities are concerned, some of the occupations are more demanding. It increases flexibility. On the contrary, if you're doing a desk jobs, the flexibility is likely to decrease. So you should opt for a lot of flexibility exercises such as yoga to increase your flexibility overall. So in this slide, we have talked about the classical definition of flexibility and try to talk about some of the factors which are responsible for the flexibility of an individual. Now, as I have talked before, now we are going to brush up our anatomy skills just a bit. If you want to talk about the cardinal planes, there are 3 cardinal planes in total, and I'm going to talk about each of them very briefly. So the first one is the sagittal plane. Always remember that the sagittal plane divides our body into 2 halves, the right half and the left half, as you can see in this picture. And this is responsible for the flexion and the extension movements. For example, if I'm doing the flexion and extension, the elbow joint, this movement is taking place in the sagittal plane. So this is at elbow joint, this is the only movement which is possible. We can also have flexion and extension in the wrist joint, and this is also taking place in the sagittal plane. If you talk about the frontal plane, this divides body into 2 halves, the front on the anterior half and the back or the posterior half. And the abduction or the abduction and the adduction or the adduction movements are taking place in the frontal plane. So if you know what is abduction, it is the movement away from the median plane. So if my hand is moving away from the median plane, away from the center, it is abduction. And if it's coming back to its original position, this is the adduction or the adduction movement. You can have movements at the transverse plane as well. Sorry, it's written incorrectly. This shouldn't be the sagittal one. It should be the transverse one. So it divides the body into an upper half and a lower half. And all kind of rotation movements are taking place at the transverse plane. For example, if I'm trying to rotate my shoulder like this, then the movement at the shoulder joint is in the transverse plane. So we have the flexion and extension movement at the sagittal plane. we have the abduction and the adduction movement at the frontal plane, and we have the rotation movement in the shoulder joint and also in the hip joint in the transverse plane. Now, after finishing the anatomical consideration, let's discuss some of the mechanical properties of tissues, to connective tissue to be specific. And I want to discuss this in the form of an exercise. So for you, I will put the 3 definitions and I will put the elaborate discussion about these definitions. You can take 1 minute, maybe 60 seconds. I will or pause the video, think about it, and then I'll give you the answer at the end. So the 3 terms which I want to talk are the elasticity, the plasticity, and the viscoelasticity. And the 3 definitions are displayed on the screen in red, purple, and green. And your task is to pause the video, take 60 seconds, maybe a minute or so, and try to match the definitions with these terms. So one of them is for elasticity, one of them is for plasticity, and one of them is for viscoelasticity. Great. I hope that you get your answers right, and now it's time to give you the answers. So the elasticity is very simple. It is just like a rubber band. If you stretch it, it will attain a new position. If you leave it, it will come back to its original position. And that's what the definition says. As far as the plasticity, it's the tendency of a material or any substance to assume a new and a greater length after stretch has been removed. So if you stretch it, it will attain a new position. If you remove the stretch, it will not go back to its original position. So this is opposite to elasticity. And no prizes for guessing. The one which is left is viscoelasticity, this 5-6 lines, complex definition which is given. But if you want to make it short, this is a combination of viscoelasticity. So basically, it says that a time-dependent property of the soft tissue which initially resists deformation. So if you try to stretch it initially, it won't stretch. However, in the later state, it gets stretched, but after a fair bit of time, it will come back to its original position. So it's a kind of a property which is between the two. It has some component of elasticity coming back to its original position and initially resisting stretch, which is the property of a viscous substance. Great. So after knowing the anatomical considerations, different planes about the movement of the joints, and the mechanical properties of connective tissues, let's try to move towards more concrete stuff, but just a couple of quick notes. Flexibility is joint specific. So there is no single test which says, okay, our whole body is flexible. For every joint, every part, separate flexibility tests, and it's possible that your core is more flexible. It's possible that your upper body is more flexible. So it's a kind of a compartmentalized, notion. We also cannot compare flexibility amongst the joints because there are some joints, for example, shoulder and hip, which are really flexible and they have a huge range of motion of 360 degrees. And there are some joints, for example, neck joint, maybe the joint of our back or the vertebra, they are less flexible, decreased range of motion. Some of them are really complex, for example, the ankle joint, because of a lot of complexity in the structures which make up that joint. Now, we can test joint flexibility either directly or indirectly. For example, if we talk about direct measurement, we use this instrument which is displayed on your screen. This is a goniometer. It determines the total amount of active and passive range of movement available in a joint. So if your joint is moving in a 2D plane, in a very simple fashion, you can use a goniometer, which is a combination of two scales, and there are the angles which are there on the connected to this instrument, and you can measure what is the range in which the joint is moving. It is actually pretty simple. We have those goniometers. I can show you it in the lab, but we are not going to use it in our practical today. This is a kind of an improvised goniometer, and it is known as inclinometer. But the difference is that this is not that simple as a goniometer. The reason being that it is not in a classical 2D plane. For example, this is a joint which is just moving in one plane. For example, if you can see on your screen that people are trying to measure movements of the vertebra or the movements such as the pronation and the supination, or the inversion and eversion at the ankle joint. So because a lot of angle or inclination or a twist is involved, we use this complex kind of a device which is inclinometer. So this goniometer and inclinometer can measure joint range of movements of the joint or joint flexibility directly. But there is a better way to assess this flexibility using flexibility tests, which is the core of our lab's objective today. So as far as indirect flexibility testing is concerned, we can have the traditional sit and reach test and the chair sit and reach test, and we have the shoulder elevation test and the back scratch test. So from now onwards, up till the end of our discussion today, I will concentrate on each of these tests, and the first two tests, the sit and reach test, which can either be done traditionally or using a chair, you have to perform in our lab today, and the data sheet needs to be filled with the help of these tests. So traditional as well as chair sit and reach test checks the back and the hamstring flexibility. This is really important to know. And on the other hand, the shoulder and the back scratch test checks the flexibility of our shoulders and back. So once you are doing any test, the first thing which should come up in your mind is that which kind of flexibility am I testing? So we'll first discuss the back and hamstring flexibility test. And the first one, which you have already seen, is the traditional sit and reach test. Okay, so if you see this diagram, this blue colored box is the instrument or a kind of an equipment which you are going to use to measure this test. And you can see that the person is trying to measure his back and hamstring flexibility using this test. So I have a lot of points here. The first part which I want to emphasize is that you have to do warm-up. And warm-up is of two types. Your book specifically says do static warm-up for 5 minutes. Do dynamic warm-up another 5 minutes. So in ideal conditions, not in our lab maybe because we have time constraint, but in an ideal world, you should do 5 minutes of static warm-up by doing either jogging or on a treadmill, or it's a general warm-up exercise to increase the temperature, increase blood supply, have your joints flexed a bit so that you can easily perform the test. Dynamic warm-up is specific for those muscles. For example, in this test, you can do lunges, you can do a static deadlift, and then after doing those exercises for 5 minutes, you are ready to perform this test. As far as equipment is concerned, we have already talked, we need a sit and reach box, this blue box, and it has a mark of 23 centimeters somewhere here, where the feet are going to be put in this test. So I have a YouTube link for the technique how to do this test, but I will speak about it very briefly and will demonstrate it in the lab as well. So the idea is that the person, after doing this warm up, sit in this particular position with legs extended, and there is a difference of approximately 20 centimeters between the 2 feet. And then the person has his hands extended and he try to flex as much as he can and try to reach as much distance as possible. And then you are going to count the total distance, which is mentioned and labeled here, and enter into your data sheets. We'll talk more about this once we'll discuss the data sheets, and you can do more than one trial. It has to be first, second, third, and fourth, and the result of the fourth trial is most probably your best trial once the muscles are optimally flexed. There are some modifications which is given in our book. We are not going to talk about this, but I just want you to know that there is a wall in YMCA Canadian sit and reach tests as well, which are just a bit modified kind of test, but doing the same thing. Now, after traditional sit and reach test, we will discuss the chair sit and reach test. The first thing I want to talk is that it is designed for the participants who are unable to get down and back up from the floor. So that's why I've put in a really vintage kind of an image of an old person trying to do that test. Again, I want to reiterate that you have to do static warm-up as well as dynamic warm-up. Static warm-up is again in the form of a jog or a treadmill or whatever cycle ergometer you feel comfortable doing, but do it for 5 minutes. Then do the dynamic warm-up. And the dynamic warm-up is again the same. You can do lunges, you can do static deadlift, and the idea is to get your muscles prepared for the test. Here the equipment changes. So instead of a instead of a box, sit and reach box, we are using a chair and a meter stick. And the person will sit on the edge of the chair as shown here, and then with one foot lying flat on the ground and with the other leg lying straight with the heel making an angle of 90 degrees and one hand on top of another, and then that person try to flex as much as possible. So first he try to reach the heel, and then he wants to cross the heel and reach as far as he or she can. And if he or she is just able to reach the heel, then your reading is 0. If is not able to reach the heel and somewhere here, then you have to measure this distance as negative value, and if he crosses that heel, this is the positive value, and we have to put these values in the data sheets, which I'm going to discuss at the end. If you want to see the whole technique, you can just click on this YouTube link, and I'm sure you'll be able to do it in a really good fashion. Now, as we are done with the back and hamstring flexibility, now it's time to focus on the shoulder and chest flexibility tests. So the first one which I'm going to talk about is the shoulder elevation test. Again, we have to do the static warm-up as well as the dynamic warm-up. As far as the static warm-up is concerned, 5 minutes, same way, treadmill, jogging, cycle ergometer. Dynamic warm-up, you want to do shoulder rotations. So you can do the shoulder rotations whatever way you want to do it. You can do arm swings, you want to rotate your shoulder, or whatever exercise you feel comfortable. Do it for 5 minutes before doing this test. You need only 2 yardsticks and a mat to do this test. I will explain you the technique, although it's given in this YouTube video, but there are 2 things to look for. We need 2 lengths. The first picture shows the length which is known as the arm length. So as you have seen, we are using 2 meter sticks or 2 yardsticks. So one stick the person will hold in his hands like this, and then with the other stick, the examiner measures the distance between the acromion process and the top of the ruler or the stick which the person is holding. So this length is known as the arm length. And you have to put this arm length into the denominator in centimeters in this formula here. And once you get the arm length, then the person will lie on his stomach, and then using the ruler in his or her hand and the examiner holding the other stick, he asks the person to elevate the first ruler with his shoulders and back as much as he or she can. So this height from the ground up till the point that the person is able to reach is the shoulder elevation, again in centimeters, and you will get a shoulder elevation score using this test. Now, the last one is again about the shoulder flexibility only. I forgot to mention a point that the last test which we did, the shoulder elevation test, is meant for checking the flexibility of shoulder as well as your back. But this back scratch test specifically designed for testing the shoulder flexibility and assesses the internal and the external rotation of humerus at the shoulder joint. So we'll do the static and the dynamic warm-up, 5 minutes each, just as we have been doing. Maybe you can do arm swings or shoulder rotation for the dynamic warm-up. Then you try to do the back stretch test in the manner it has been shown. So you flip your one hand back and try to touch the ends of the two middle fingers as close as possible to each other. We have three possibilities. Each of these is depicted in the figure. The first possibility is that if your flexibility is less, you're not able to touch your fingers. So the distance between these two fingers is taken in centimeters and is taken as negative. If you are just able to touch your fingers, your reading or score is 0. And if you're able to overlap your fingers, then you have a good flexibility, and that measurement is taken in plus or positive. And we are going to put these values and compare it with the normative data table. So we need only a measuring tape because we just have to measure this distance. So you can have a measuring tape or a ruler and you can measure this distance. If you want to know about the technique, just click on this link. And of course, we can discuss all these 4 tests in our lab today. This is the lab data sheet. Finally, we are done with all 4 tests. And before moving on, I want to clarify that although I've tried to discuss it in some detail, which I think I had, but if you're not able to clear with any of these techniques, we can always try, do, and practice in our lab today. So we have to do activity 3.1, and you have to fill in your basic details, and the things which are scratched off in red, you don't have to do them. We are only performing traditional sit and reach test and the chair sit and reach test. So the first column, you have to put the values of the traditional sit and reach test, trial 1, trial 2, trial 3, trial 4, and you put the value of your best trial here because it is most probably the value which you got the best. But don't put the best here because the column has already scratched that off. As far as the chair, you have to put the values of the trial 1, trial 2, trial 3, put the value of the best, the 4th trial, and take an average. So the idea is that for the chair, you have to take an average. For the traditional one, you don't have to take an average, just write it for the 4th trial. Now, once you got these values, you have to compare it with the normative data table in context of percentile. I want to spend maybe 2 to 3 minutes to put these values because it has always been a bit ambiguous for students who have taken this course in the past, and we have always been asked a lot of questions how to compare and put the values into normative data table. So at least I want to clarify as much as possible today. So if you get a value of fourth trial as 30, so you put 30 here and then put the value of this fourth trial in this column here. And then you try to go to the table 3.2 and try to compare that value. So this will tell you have to find your age. So everybody is in this age group, 20 to 29. And depending upon your gender, male or female, if your value is 30 and you are a male, then you put the percentile as 60. So if you go back and put 60 here, you are doing a really great job. On the contrary, if you are doing the chair sit and reach test and you get a value of, let's say, 4, 5, let's say 6, and then you take your best value, do it a fourth trial, and then take an average. So once you get an average, then you will put this average value in here for the right leg and this average value here for the left leg. And once you put these values, then you go to this table 3.4. And unfortunately, because this test is designed for people who are old, you have to use this age group 60 to 64. I know everybody is there in the 20 to 25 group, but this is the lowest age group which we have as far as the normative data tables are concerned. So you try to fit in your value depending upon your gender, male or female. So example, if your average is 6 and you are a male, then you want to put it somewhere in between the 30th and the 50th percentile. So if it's 6, I will put it somewhere 44 or 45 percentile. So you have to do it a bit subjectively and just feel that the nearest value which you get depending upon the value which you got after completing the test, just put it in the value. And we can definitely discuss a lot more about this normative data table stuff in our practical today. So summarizing everything what we have learned so far, we started about discussing the importance of joint flexibility. We talked about the basic definition of flexibility and talked about some of the factors which affect this flexibility stuff. We have talked about the three planes, the sagittal, the coronal, and the transverse plane. Then we have discussed the properties which includes plasticity, elasticity, and viscoelasticity. As far as the instruments are concerned, we have talked about the goniometer and the inclinometer and which kind of movements are used for using which particular instrument. Those were the direct methods. For the indirect methods, we have talked about 4 tests: the traditional sit and reach test, the chair sit and reach test, the shoulder elevation test, and the back scratch test. And then at the end, we discuss how to put the values which we get out of our flexibility test into the data sheets and compare it with the normal values. I hope you had a great time listening to this video and you'll be more excited doing the practical in the lab later today. Thank you very much.